Bonjour Montréal, tous qui sont d'ici. Je suis ravie d'être de retour à Montréal parce que j'ai vécu ici pendant 6 ans et j'adore les Montréalais. For those who understand English, French. I used to live in Montreal for 6 years, and Montreal was my second home. I left Yugoslavia and moved to Montreal, and I love Montreal, so I say thank you for them. Eyebrows, the purpose of eyebrows is to frame the eye, enhance facial features, and also provide the expression, quizzical brow. Eyebrows also can determine a style. If you look at the style of 30s, the thin arched eyebrow determined the era in a style. 50s, thicker eyebrow, and in 80s and 90s is thinner eyebrow. So when we look at the eyebrow, we just don't think few hairs on a face, but rather facial feature, style, and a function. And one of the function is to keep the sweat running down into our eyes. Indication for eyebrow transplant can be burn. Someone can burn themselves and end up with a scar and need eyebrow transplant. Scar from the injury, piercing, or direct brow lift. Later in my presentation, I will show you a photograph of a person who had the direct eyebrow lift. Alopecia areata, low density due to plucking or waxing can also be an indication for eyebrow transplant. And congenital absence, which would be either uneven or thin eyebrows. The uniqueness about eyebrows is that hair quality is different than the hair we find on our head. Interestingly enough, in Caucasians, the eyebrow consists of the stronger hair comparing to the hair we find on the head, and in Asians is the opposite. Hair angle is very flat to the scalp or forehead, almost parallel to the skin, comparing to the hair angle on the top of our head, where it varies from 10 to 45 degrees. And hair direction is, there's a two part to the eyebrow. Medial part, it is just above the nose, and the hair grows upwards, and then the lateral part of the eyebrow where the hair grows crisscross, the upper portion goes down and the bottom portion goes up, the other way, known as a fishbone. The shape of the eyebrow can change from female to male shape and show differences. Female shape is thinner and male is thicker. We're not talking about plucking eyebrows, just the original eyebrow will be usually thinner in female. And the female eyebrow would represent more curve, while eyebrow in male is more straight. I just include a few images to show you how the shape of the eyebrow in female can vary, and then in male too, from different thickness to different arch. We also find a difference in eyebrow shape looking at the different ethnicities. I compare Caucasian and Asian because they're mostly obvious. In Caucasian, they're thinner and straight. In Asian, they have a little bit thicker lateral portion. So if you see on the images, Brad Pitt would find, you will look at his eyebrow is more straight, and the Asian eyebrow has a thicker lateral portion. In a consultation for eyebrow transplant, it is important to mention that the eyebrow may not be symmetrical, and the patient has to be aware of that before undergoing eyebrow transplantation. Also, we have to mention that the hair will grow long and would need to be trimmed at least 1 to 3 times a week, depending on how fast the hair grows. But also we can explain to a patient that sometimes it may take several years, and then the hair may show slowing down in a growth because of the recipient dominance. And another important thing to mention during the eyebrow consultation is that we may not achieve expected density. Sometimes people desire really thick eyebrows, or the eyebrow may not grow because we are transplanting mostly one hairs. And so in that regard, we have to make sure that we inform the patient that may require another session. I work with Dr. Lehman. He usually has this expression that he says that what we say to the patient during the consultation is education, but we can say the same thing 3 months down the road, and then it would be an excuse. So you better use that time for education. The principles of eyebrow transplant is that the basic principle of taking hair from the back, transplanting an eyebrow is the same, but we have to select donor hair according to the hair caliber. We're looking at thicker hair. We are going to look through the donor area until we find a hair, let's say in Caucasian, that is coarser. Sometimes it can be in a temple, sometimes it can be high. If we're, let's say, restoring female eyebrows, it can be very high on the back of the head. The closer we go to the occipital area and the neck, hair may be finer, so in Caucasians we may avoid that, and that is exactly what we may be looking for Asians. We also look for 1 and 2 hair follicular units. Occasionally we can use 3 follicular units in male patients. And another principle in hair transplantation for the eyebrow is to look at hair growth in the eyebrow and make sure that we direct hair properly, and look at the curve, and I will explain this a little later about how to make sure that the curve in each graft is facing the scalp. Eyebrow proportions, as you see here, just kind of guidelines how to design the eyebrow, because there's a definitely little arch, and looking at that arch we have to direct our hair growth and grafts. As you see, the A line is the inside of the eye, B is the lateral portion of the iris, and the C is where the eyebrow should finish. Just a small image or quick look at the difference between a female and male eyebrow. Male eyebrow will be flatter and more thick. Donor selection and site creation, we're going to look for the appropriate caliber and follicular unit distribution. We're going to avoid the areas where we have most of the 3 and 4 follicular units graft, and find the areas where the hair is coarse and are also mostly contain 1 and 2 follicular units. Sites are usually made with 19, 20, 21 gauge needle. Area in our office area is tumesced to provide, in order for us to put more sites in one area, we tumesced the area so the skin slightly stretches. We can place more hairs, and once the tumescence subsides, we achieve higher density that way. And insertion of the needle has to be really flat with the scalp, and we bend our needle so that we bend it at a 90-degree angle so the needle can come flat, and my hand is away from the scalp and allows entry point to be parallel to the skin. I designed a little, just kind of bear with me, how we can distribute our grafts, and mostly we use 1 hair follicular units, what you see with the blue arrows, and always at the periphery of the eyebrow. In the inside, middle inside portion, we can put 2 follicular units to provide a density, and occasionally we can use in the same area 3 follicular units. The core of the eyebrow will be designed and populated with 2 follicular units so that it gives the core along which the hair will converge from the upper and lower portion. So 1 hair follicular units are coming from the above and below. They provide a thin outline, nice blending, and the definition of the eyebrow is created with 2 follicular units. I also try to demonstrate how important it is to look at the hair angle and look at the portion of this curl closer to the arrow, and it's showing how hair has to curve up, curve down, and I hope this is clear enough. This is the crucial part in hair transplantation of the eyebrow. If you have your hair angles pointing away from the scalp or in a wrong direction, they cannot be camouflaged. They cannot do anything. If you perform eyebrow incorrectly, they cannot do anything to camouflage poor result. Contrary to hair transplantation, someone can have a styling or camouflaging products to help direct the hair. In eyebrows, there is nothing that can be done. Complication. Sparse eyebrow may not be considered complication because it can happen, but at any event, sometimes they may grow unevenly, or we can have a poor hair growth, and so that can be considered unhappy patient as complication to the patient. Poor hair angle, hair sticking up, that is the curve I was talking about. So your hair has to curve toward the scalp, it should not curve away from the scalp. Poor direction, and then poor angle. Another thing, I'm sorry, I kind of skipped from one to another. Poor angle would be not directly the upper portion to down and down up, and then a curve away from the scalp. A natural healing, pitting, milia. If we position our grafts too deep, they can either cause pitting, uneven healing, and unsightly result. And poor shape and position of the eyebrow can be a complication. As an assistant, your contribution is in creating great result is making good quality grafts. Dissect follicular units instead of making one graft at a time. What that means is select your follicular units, one follicular units. Do not take two follicular units and break it to make two one-hair grafts, because you decrease the chance of survival. You can also damage the hair. And select your follicular units appropriately, so you really have a good result, because just the thick hair can contribute to the density of the eyebrow. During the placement, place carefully. Keep in mind correct graft size and its position where you put your two follicular units versus one follicular units. Pay attention to the hair curve, and always imagine the end result. While you're placing hair, think about if your hair is curving in one direction, what would look like 6 months down the road. This gentleman is an interesting case because he had I'm not sure if you can see this, on the bottom portion, he has a thin eyebrow, but he tattooed the upper portion of his eyebrow. He wanted thick eyebrows. So we transplanted his eyebrows, and the result you see on the bottom is 1 year after. This is a lady who had direct eyebrow lift. She went to Asia, and Dr. Lam first had to correct the scars. I hope you can see it was indented, was terrible. And her eyebrows are thin. We're looking at 9 months after the transplant, and we will go again and do a second pass. I will have a little video of this lady. Her story is that she had a surgery to remove mold from her eyebrow, and we repaired just one side. What you see, her left eyebrow was repaired. And the difficulty when you're repairing eyebrow, only one, when you're transplanting both eyebrows, both sides can look alike because the same type of hair will be used. Transplanting one eyebrow, you have to be very careful because you are now risking for asymmetry and really a difference in left and right eyebrow. And I will share. And this is her testimonial. And if it happens, and there it is. Sound.
And I want to share about my experience here because I had a great experience. And I had a fun face until I had a little back on the other side of my eye that was only a quarter-inch big, and found out I had to have no surgery to remove it, and it ended up a 3.5-hour surgery with a lot of tentacles, and it took a really big chunk of my face, a big hole about this big, and had to go to several people to get it closed, and it left a very big space in my face, and there was just a little bit of all around here and a little bit here, and it felt really disfigured and upset me very much. And I was very grateful to find this Dr. Lam and his group, because we couldn't find anyone else who would who would try to really take my case. And I had a very good experience here. They were very hunting and treated like a family. And as you can see, now it's been 4 months and my eyebrow's going in so well. I had a transplant on the back of my head here, and I'm very grateful to Transplant to stick it in more and to be able to smile on the face of people. And I'm grateful for the expertise and kindness of everyone here who treated me so well. And it was a very happy experience in every way. And I'm grateful to be through the surgery and done and better.
I used this video for just to tell you the reason behind it is when she came to our office, she had a little band-aid to cover this scar. And for most people would be, just a little scar on her eyebrow, it's not a big deal. For her, as you see, it was a big deal. So never underestimate the power of few hairs. Thank you. And I don't know how to exit. You want to take it?